Jenn Flow Massage Therapy. I have a client who stands all day. And a few years ago, she had a knee replacement. Even with the standing, she was out of alignment. So she'd get on my table, I'd redo her hips, show her how to do this, show her how to do that. And 80% of the pain in her body went away. But the last 20% was centered around her knee. I love this client. And why do I love this client? Because when she has pain, she goes, "What's going on here? How do I fix this? How can I make this better?" And she had already done all the exercises I asked her to do. She had already changed her posture, changed the way she was walking, everything. She did everything. And so we pondered about that last 20% of nagging pain in her knee. And she goes, "I'm going back to the ortho. I'm going back here. I'm going back." Anyway, she hit every ortho she could in the area. And then she finally said, "Screw it. Their responses don't make sense to me." So she went to UCLA. And she met a different ortho there. You know what he told her after the MRI and the x-ray? They put the wrong size knee in your leg. What? Yes, it's the wrong size knee replacement. So what does she have to do? She has to replace it with a brand new knee. So for the last 3 months, we've been prepping and rehabbing that area to make sure that in this whole area, down to her feet and up to her hip and up to her torso and neck, that it's as open as possible, and the left side also, so that when the surgeon comes in to cut, he's cutting through butter. Why do you want a surgeon to cut through butter? Because if you've got a muscle that's tight like this, it's going to make it really, really tough for him to cut through, and then really tough if he's cutting across to take your tight muscles like this and put them back together and stitch it. So you don't want that. You want to give him the best environment possible. You want him to cut through butter. Okay, unless it's an emergency, then you do whatever you have to do. And so we've been working together. And cutting through butter does not mean she's flabby. She is very fit. It means she has perfect range of motion to the farthest extension that she can and contraction. So she is very, very fit. And she is very, very ready to go to UCLA and get her knee replacement, okay? As well as she's already booked sessions with me for post-operative work. So if you have something going on in your life, you need to consider massage as part of your pre- and post-operative procedures, okay? See you soon. Jenn Flow Massage Therapy.